Hello, welcome to the stream. We're live. I'm just going to welcome everyone to Chinese Medicine Podcast, the live stream. We're going to be doing some Q&As today, some questions that I've got prepared from banked up on the channel I need to answer. And if you've got a question, you can ask it in the chat. So I'm going to just jump into some questions now and we'll get started. So welcome everyone. Hope you're doing amazing. Just have to find these things I've somewhat prepared. Let's have a look. So these are in no particular order. Well, they're going to be in no particular order. They're just questions that I've had on the channel to... I'm going to get rid of that. No, we don't want to get rid of that. Yep, I knew that would happen. Okay. I've got a new camera. So let me just try this other way. Normally I could just add the questions in to the bottom of the screen. It's normally pretty good. Anyway, so if people have a question, they want to ask it, then feel free to ask it. Okay, that's not doing that. We might need to have a transition picture or something here. Image. No. Image. Question 1. Okay. Question 1. Right, I'm just going to have to do this back and forward. It's going to be weird, but anyway. It is what it is. I'm still here. Here we go. This is what happens when you have to do it all yourself. And there's always something a bit to sort out. So I've got quite a few questions from the channel, just been asked on the channel. And I'm going to be doing my best to answer these ones today. And if you have a question, you can pop it into the comments. Let me know where you're tuning in from. It's Friday. Coming on Friday night here, so Friday evening, and I'll probably just do this for about an hour. We'll see how we go. I think I've got one from Instagram to answer as well. So having a look for that one. Yeah. Cool. So this particular question, let me see. I've made it so small I can't see it. Read it myself. Okay, so this is from Ian Yoga, I think. Hey there, I recently learned about the 5 elements in my yin yoga teacher training. I've been diving into your old videos to whichever topic resonates. Okay, that's great. That's awesome. You mentioned that you're a woody type of, and this is on one of the 5 elements personality type videos, I think. You mentioned that you are, talking about me, I'm a woody type of person, and that you also that you struggle with cleaning your space. I think I'm also quite woody. Now I'm in my 30s and I've accepted that I did not learn to keep my space clean as I grew up. I thought, haha, do you think those are related? Yes, I do. I think there's so many things here to talk about. That's why I thought I'd just mention this. It's probably not worth me making a whole video on this topic, although who knows, maybe people would want to listen to me ramble on about this stuff. But some of it's nature and some of it's nurture. And I think it's part of it is the 5 elements, personality types. It gives us it's like your genetic code, right? But then it's like some of those things could be nurtured even more given the right circumstances. So I can only speak to for my own life. I don't know what's happened in your life, but I grew up in a family. My mum particularly is very creative, and she's not great at cleaning up, but she let us be really creative. And so the upside of that was she would let us, as kids, we did have to clean up, but we weren't taught how to organise things, because I don't think my mum was very good at doing those sort of organising. And my dad just wasn't, around to he was busy running his business and doing stuff like that, and that's fine. He's a great dad, but like I didn't have anyone to teach me how to organise things or how to have a process to clean up, right? Or even to practice those things when you're little, like giving things away or or clean, like letting go of things. And so there's those things can be hard when you clutter and you keep things there. But for me, I think I might have mentioned this on the video, like it gets to a point where it's no longer functional for me, and then I clean up, and then I'm like, oh, I really enjoy this beautiful clean space, aesthetically nice, and I'm not cluttering everything. But if there was no one probably coming into that space, it would probably get messier than it does now, right? So the benefit of having others around you, like knowing that someone's going to come there, probably makes you keep things cleaner. But it also, for me, it when it interferes with the function, I'm just like, okay, I need a clean space so I can do this next creative thing, this next creative project. But I think being a person that's driven, it's not so much like what your element type is, but it's what your element type isn't. So if your dominating type is metal, that's usually very, if you're properly orientated, in balance, you'll probably be really good at organising and very frustrated by things not being organised. So the upside to the wood type is, because, well, for me, is creativity, and like I can get on and do things, and I can have multiple things going on in the same space, in the same room even, like as in, here's a project I've started over here and I've just left that there. I don't have to pack it away, whereas I know other people have to pack things away. And to me, I feel like, that packing that away when I know I'm going to get back onto that soon, that could be a hindrance. And what might look untidy to other people is organised to me. Like, I have a system within my system. So yeah, I hope that sort of answers that question. So yeah, I think it's related in terms of what you're taught when you're younger teaches you patterns and how to manage things and deal with things, and either to how to thrive in that environment, like what you value. Like in our household growing up, it wasn't really that much apparent until and I recognise I did have a very different upbringing, because you don't realise this until you talk to other people. You think what you're around is normal. Everyone thinks how they grew up is normal, and I don't mean it anyway. Nothing bad happened, nothing like terrible happened. It was just an interesting time. Like for instance, we had a rule growing up. Like I played the violin. My brothers and sisters ended up playing the violin as well. My sister and my brothers. So I've got 2 brothers and 1 sister. And my mum used to have this rule, like if after dinner we went and practiced our violin, we didn't have to wash the dishes. And we just thought that was normal, and that was not until I grew up older that I realised, okay, that was mum. And who would wash the dishes? My mum would wash the dishes if that was the case, right? Now, sometimes we would wash dishes, but that was kind of just a rule and in the house. And that was mum's way of encouraging us to practice, because there's times where you don't want to practice. And she was like, well, sometimes that felt like a chore in itself to have to practice. But, and she like it was, I guess mum's way of recognizing that, and recognizing I want you guys to practice your violins, right? And then my parents had a business, and they would often go away. And I think I'm the oldest, and my youngest brother at that time would have been probably about 4 or 5 years old, probably maybe something like that. I think he would have been about 4 years old. There's 9 years difference between us. So if he was, I must have been 13 or 14 or something like that at the time when my parents went away. And they had this other family from our church come in and stay in the house. So they had 2 little kids, I think, and like there's 4 kids for them to look after. So they came and stayed in my parents' house and looked after us while Mum and Dad were away in Germany or France or something like that, doing their business stuff. And when my parents got home, they kind of had a word to them, and they said, "Oh, your kids are so lazy; they don't do the dishes after dinner." And they said, they said, "We don't do dishes in our house; we do violin practice." And this other family saw that as like, "Oh, you obstinate kids, like you're doing the luxury of having your music practice instead of doing the dishes." And I just always remember that story because I didn't really realize that the other kids didn't have that option, that the other kids did have to do the dishes, and that's what I mean by like I grew up in a very creative household. Like my mum was always like what she would do for school holidays is buy us, well, not even buy us, my mum would make us a massive scrapbook thing, like A3 size paper or even bigger than that. I had access to massive paper because she was a printer, and she would sew this thing together and give us this blank, like a massive scrapbook. Basically, for the 6-week school holidays, that was your crafting thing to sort of fill that up with whatever you want to fill it up with, like craft something in there and color in things and stick things in there or whatever. And anyway, so to answer that question about is it nature or nurture, I think part of it is your nature, but then it's also whatever you're nurtured with. So like all of the kids in the family, so there was 4 kids, and we all had the same, let's say we all had the same, pretty much similar, same opportunities in terms of, like we were given rewards for creativity and doing those sorts of things. I hope that the audio is right on this. I did a little test on here before. But sometimes when people jump in and out of the audio, jump in and out of the stream, I sometimes think, is the audio right or not? But I can only test it on here and check. Anyway, so it's not until you come across other you see what other people grew up like to realize, well, what did I grow up, was my upbringing, you just think that's normal is what I'm saying. But there's definitely part of it is your nature, right? So not, I would say I'm the most creative out of the 4 of us in terms of the arts, like, creative arts and stuff. And my sister, creativity is something where you can go in many ways, right? But my sister's the least creative, I would say, out of all of us. But she was given plenty of opportunities to be creative as a kid, if that makes sense. And she loves to make things, and she really got into sewing when she was younger and things like that. But, as an adult, I'm the only one who's sort of pursued music, but that's been way down the track of my life as well, right? So it's, big gap of not kind of pursuing it as a thing. Anyway, what I'm getting at is it's a bit of both. It's a bit of how you're brought up, and it's a bit of your constitution, your elemental type, your genetics. That's all part of that. So, I think when you're like the wood element out of all the types is the most dynamic in terms of movement. So you've got, it depends on what your second element is, I would guess, to say whether you've going to struggle with cleaning up your space. So you need metal and it potentially like earth to kind of clean things up, right? I think those are the 2 elements that bring organisation and structure and rigidity. Probably somewhat water as well, like discipline. That comes from metal, and so we all have all of those aspects in our life. Anyway, so this started off with a bit of a randomish kind of question. So who's watching now has a question, you're welcome to put your question in the comments, and we'll do some live Q&A. I'm just catching up here on some questions that I've been missing. I am just going to check on the audio of this, make sure it's okay. We'll put that down. I'll get rid of that. So let's have another question. Okay, so we've got a question about arthritis here, and this is kind of a bit of a short answer and also a long answer, I guess, in the both. I'm just going to have to do something a bit strange here. So I'm still here. I just have to put myself in. I don't know why it's doing this thing. Yeah. Anyway, we've got the question here. I'm just gonna, add that in. There we go. Every time I do the question, I kind of have to do this weird flipping back thing. I'm not sure why. Something's happened. As long as people can hear me okay. If you can let me know that you can hear me, that'd be great. I think there's some question here now on the live, so that's cool. That's good. Diana, if you can let me know, can you hear me properly? Because I just want to make sure you can hear. Oh, that's great. There's a few questions there. So I'm going to quickly answer this one. This one's from Instagram. And Ellie says, hi, Marie, can Chinese medicine reverse arthritis? So the answer is no. Oh, great. You can hear me good. The answer is no. Nothing can reverse bony degeneration. Okay. Now, I have to be really careful with making any sort of claims about conditions treated because of Australian government guidelines on potential things that are advertising, and because my clinic is associated with this, well, what I do in Australia is associated with this channel. It could be what we talk about here could be interpreted as advertising, so it's not necessarily a class, a teaching environment, although it is a semi-teaching environment. So, but arthritis, or the pain associated with arthritis, is definitely something that acupuncture has been shown in a research setting to have good effects in some cases. So in some cases of chronic lower back pain, and certainly in knee osteoarthritis. So from a claims of what acupuncture can do, I can speak to those things because there's that evidence there. Now, that doesn't mean that it's not something that a practitioner can't approach or can't treat, but it's just claims of what we can do. So this is a really bold question, or not bold, but like a direct question: can Chinese medicine reverse arthritis? So I doubt that even anything can reverse like degeneration of the bone if we're talking about osteoarthritis. If we're talking about like rheumatoid arthritis, well, both of those conditions have a significant aspect of pain and inflammation. And what I can say in terms of arthritis is that, like, I will often see patients' pain reduce, yet the arthritis is still there, as in the degeneration, let's say the bony degeneration is still there. Okay, another example would be, I have had patients that have come in for lower back pain. Again, I can speak to this example because this is something where in an advertising sense, we're allowed to talk about these things because of the pain aspect, and because I don't want this to be interpreted as a claim or as this is an example of, like, I'm not trying to state a result of treatment. Okay, but I've had more than one patient come in with lower back pain or some kind of pain, and they didn't know there's arthritis there. They didn't know there was any bony degeneration there. Like, what I mean by the bone is losing its integrity, and the only way you're going to know that is if you go and have a scan. So these are people that have had sciatica or some kind of lower back pain, and you start the treatment off, because there's nothing to stop us starting a treatment off without knowing about seeing those scans or anything like that. So we would do that, and for some patients, they're waiting to go and have a scan. They're waiting to go and get in the MRI machine or the CT scanner or whatever it is. And, like the treatment that they've started with you sort of coincides with when they get the scan, and it's almost like it's good that they do. I encourage people to get the scan, because otherwise they won't know exactly what's wrong there. And when they have a scan, they might find that they've got degeneration, but the pain has gone significantly down from when they first come to see me, quite often at that point. And what that's telling you is that the pain doesn't necessarily have an association with the degeneration, right? Now, it is going to be a factor in there, but it's not the only thing, because the acupuncture can't reverse that degeneration. It's still there. And another example of that is a person could have nothing wrong with them in terms of pain. They wake up one day, they've got excruciating back pain. They go and have a scan, and it shows bony degeneration. Now, that's not necessarily arthritis, or it might be diagnosed as osteoarthritis, right? Like degeneration. So I'm not sure what this person means exactly. Does it mean rheumatoid arthritis is a different disease to osteoarthritis, right? Osteoarthritis is like from things degenerating, either because you've had a lot of wear and tear on something. So it can happen as a younger person because you've got a sports injury from, a lot of wear and tear on a joint from sports or something like that. Overuse kind of injury, wearing things out, or just age, things like that. Anyway, they have the scan, and it's like, well, that bony degeneration that shows up there, that's been there for ages, because it couldn't have just happened straight away. Like, bones don't just degenerate, as quickly as the pain came on. So the answer is no, we can't reverse the arthritis. So I'm going to send this person a message on Instagram to let them know the answer to their questions here. Somewhat. All right, we've got these other ones here, which is great, down the bottom here. Diana. So I'm just going to screenshot some of these. Answers. So you want to ask, these are great questions. I can definitely speak to these things. Just going to put these in here. Hope everyone's having a fantastic, there we go, it's coming in, a fantastic day or night or whatever's sort of happening for you. So these are the questions we're going to be asking. This thing just sort of decided to shut the biscuit. That's the system that I use tonight. It just sort of, we're adding these things in there. Anyway, I'm going to put them next to me. Hopefully that's big enough for you to see them there. Cool. All right. So Diana wants to say thank you for all your content. I found it really helpful. That's great to hear. I love reading people's comments, and I'm glad that the channel's found you, and it makes my day sometimes, because we all go through ups and downs, and sometimes you think, oh, should I keep doing this stuff, or what's the point of it? So that's good to know. I'm a myotherapist, and I've become really interested in Chinese medicine. Okay, that's cool. Question is, would you have a place you could recommend in Australia to study Chinese medicine? And then the second question is specifically one that focuses on classical Chinese medicine. So I'll give you some things to look out for, and I'll tell you there's not going to be one place where you can do particularly your undergraduate degree and have all your boxes ticked. There just isn't, unfortunately. Okay, and I'm not going to be starting up a school. anytime soon. Although shameless plug for my course, I do have a course, but it's not to teach you to be a practitioner, but it will help you understand and learn Chinese medicine. And you're welcome to check that out. And I've put the link in the description below for the new opening that I've got for Better Gut Health, which is a short course, okay? But that's not the answer to this question. So in Australia, you have to... okay, I actually just finished filming and I wasn't sure whether I was going to bother editing it and publishing it, because sometimes I get these ideas in my head and I'm like, oh, I'll do a video about this. And it was about all the regulations of natural therapies in Australia and like which areas are regulated and which ones aren't regulated. I don't know if that's something people want to have a video about, but I could finish that. I could edit that up and put that out there. So in Australia, the regulation system is through APRA, which is regulation of title, not regulation of practice. So if you want to register as an acupuncturist or a Chinese herbalist, you will need to study an APRA approved course, as in a Chinese Medicine Board of Australia approved course. There are other shorter courses out there, or little courses or intro courses and things like that, but most places that are offering these undergraduate programs are going to be registered, but that's a question you should ask them, right? Is it regulated? So I'm not sure where you are, what state you are in Australia, because that's going to make a difference. You have to do it in person because there's going to be some clinical components to doing it with that. But many colleges now have almost half the degree available online. With some people love that, some people don't love that. For many years, I taught at Endeavour College, so I was a teacher there for more than 15 years, probably 16 or 17 years. And I've just finished teaching there this year, so I'm not teaching there right now. And so I know a lot about that course, but that course isn't sort of that unique to that college in a way. It's very similar to others. So I can't speak exactly to what's in the other courses because I haven't taught at those colleges. But on the whole, the issues that you're going to face about the content of the course is not going to be only at one college, I think. And the issues for me is that there's so much focus on Western medicine. And like you're saying, you want a course that focuses on classical Chinese medicine. Well, unfortunately, there isn't one. The only college I would maybe look into that might be a little bit different to the stock standard is probably Sydney Institute of Technology. That's so there's not that many options. Okay, there's Endeavour College of Natural Health, which is going to give you an undergraduate qualification in either acupuncture. It's not a great course for Chinese herbal medicine, in my opinion, because it's the undergraduate part of. It's not a 4-year program in Chinese herbs. It's just a 1 year on top of the other stuff, right? I don't think you can study it as just a standalone Chinese herbal course. It's a course that's designed for acupuncturists and then do herbs on top of that thing. Not that there's anything wrong with that. That's what I did. I did herbs and acupuncture concurrently as the stuff that I studied, as the way that I did it. If you want to do classical Chinese herbal medicine, I would highly recommend the college. Well, it's not a college, but the institute where I studied, which is Institute of Classics in East Asian Medicine. And there's several videos that I've got on this channel with interviews of my teachers on here or people that teach in my course. Okay, so there's one with Laurie Ayres, and that was the most recent one on that stuff. There was another interview with a guy in the US called Colin Campbell, and those are good ones to check out just to see are those types of teachers, because they're the people that will be teaching you, is that kind of what I'm into? And I think you'll know from sort of listening to that sort of stuff. It's really, 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 really unfortunate that that course isn't available as an undergraduate course. Like, you're just going to have to suck it up and do the undergraduate course, whether you do it through whatever colleges are offering it, because that's the way you're going to be able to graduate with something that will let you get registered with APRA. But that course at Endeavour, for instance, isn't going to be a classical Chinese medicine course. Now, you're going to learn some classical Chinese medicine ideas, but it's not rooted in classical Chinese medicine. And what I mean by the issues I think that the undergraduate courses sort of are facing now, and it's not necessarily their fault as an institution, is that there's just more and more push for things to go be assessed on Western medicine research methodology rather than be assessed on understanding Chinese medicine theory. And that's a new thing for Chinese medicine, as in the last few years. And there's lots of people in our industry that think that's great. They think it's a really good thing. They love that. I think it's bringing Chinese medicine into the modern times. And that's all great for practitioners who have learned really solid and sound Chinese medicine theory from the beginning. But when you don't learn that from the beginning and you kind of thrust into this dual sort of approach of I find that students don't, not all, because some students do, and they go and learn it by themselves, or they, seek it out within the classroom, even from the teachers they've got. But the students that, like, for instance, I know someone who's studying undergraduate Chinese medicine, and they're also doing Institute of Nanjing Medicine, or whatever it's called, David White's course at the same time, and they're doing the same herbal course that that I did, and good on this person, but they're like investing a huge amount of their time and money into studying three things they're in three colleges at once. So they're getting their undergraduate course, and they've realized partway through that I want to do classical acupuncture and classical herbal medicine, and they've had to go and learn that separately. So that just is what it is. So maybe, Diana, you can tell me what state you're in, because that's going to influence what's available. So there's only, in Perth where I live, there's only Endeavour College now for people to study Chinese medicine. Like, I think that's the same in Brisbane and Adelaide. In Sydney, there used to be University of Technology, and that course has closed down. There's RMIT, or you're in Victoria. In Victoria, and I'm pretty sure that course is closed. I know they closed down. So in Victoria, there used to be RMIT, Victoria University, Southern School of Natural Therapies, and Endeavour College. There used to be 4 places you could study it. Now, I'm just looking up here. I'm pretty sure RMIT have discontinued their course. I'm just looking up online to see if I can confirm that, because I know that they discontinued. They discontinued their postgraduate herbs course, and now they've got. It seems like they are offering an enrolment for a postgraduate of Masters of Applied Science in Acupuncture. That's not an undergraduate course. So the other option you've got is Southern School of Natural Therapies, which I think is been brought out by a company called Torrens University. So there's 2 options there. So the best thing to do is to go onto the campuses, give them a call, like give the colleges a call, have a chat, work out the cost, the time, look at the units that are in there, and just kind of like try to puzzle it out for yourself. Maybe talk to some students who've been to those 2 different places and see what it's like. Maybe ask them what kind of lecturers they have. Because that's, at the end of the day, the people who are teaching you. That's important, right? To who are you learning from? Does that course, because I think you're going to have to toss up between Torrens University and Endeavour. Like, they're the 2 options, I think, in Victoria. I don't think there's any other universities that do it. You can do the Institute of Classics in East Asian Medicine, which is only herbal medicine. That's the stuff I do, the pulse-based Chinese herbs. It's a lineage system. And you can learn that alongside of what you're doing. You can do that by itself, but you won't be able to register as a practitioner. You won't be able to register. Now, is that enough of a course to become a good practitioner? Probably not. Like, it depends. If you're already a myotherapist, you might already know a lot of stuff that's going to help you become a good practitioner, right? So the course I'm talking about, the Institute of Classics in East Asian Medicine, the herbs only course, it's going to help you become a really good practitioner of herbal medicine. And like, I'm biased, but as in, because that's what I do now and I love it and I wouldn't go back, and I wish I'd done that earlier. It's the best. It's results wise, structure wise, understanding wise, it's amazing. But there's nothing in that course about how to talk to patients, how to manage your clinic, how to run a business, how to manage difficult clients, all the social science skills that you do need as a practitioner. And that's what you also learn at these in the undergraduate courses. Also, how to all the Western medicine terminology. So, like, not just terminology, but the understanding. So you've kind of, the first year of college, you do quite a bit of Western medicine. You do anatomy and physiology. You do pathology, which is like diseases in Western medicine, because you need to understand that stuff. Even though you're going to be practicing Chinese medicine, you still need to understand, well, when someone says, oh, I've got tuberculosis or ankylosing spondylitis, what does that mean? What's the pathology? What's the prognosis? You might even have a course on pharmacology, which is just understanding drugs, right? So you can understand what they do. So yeah, good luck with your course. And it's so great to hear that you are interested in learning Chinese medicine. It's fantastic. It's a great profession. I do have a video on the channel about, should I study Chinese medicine? Because there's some things to consider. I think if you're really passionate about it and you love it, you're going to find a way to get through all those hurdles. But I wish I could say, oh, this is the best course. You do this and all your life's, your dreams are going to come true. Like, I could say that about ICAM, the herbs course, but it's not an undergraduate thing. So yeah. Also, you might want to become an acupuncturist, not a Chinese herbalist. So they're two separate things, right? And don't be afraid to choose one or the other. Like, now, the longer I'm in practice now, the more I'm convinced it's better to have just chosen one or the other. And yeah, you'll just become better at it. So yeah, if you've got no interest in doing Chinese herbs, the Institute of Classics in East Asian Medicine isn't going to be for you. So there's a few places you can do the classical Chinese medicine. It's called INR, Institute of Neijing Research, and the guy's name's David White. I'm just going to write that in the chat there. So that's the person to hit up. Not to hit them up. To look into their course, which is a hybrid thing of in-person and online. And I think that's probably paced as such, where you can you could do your other course alongside it, and that'll probably become primarily what you actually practice. So David's from Australia. He used to be a teacher at Sydney Institute of Technology or something, that college there, and he started his own program for postgraduate, and now he just runs that program. But I don't think you have to be a postgraduate to join into his course. You could do it as an undergraduate, I think, as well. All right. Do people have other questions? Hopefully that's answered the question there. Oops, I've done it again. There we go. Just take myself out. Yeah, so if people have a question, feel free to put it in the chat. We'll jump into some other ones that we've got here. A couple of things. A few questions. This will be number 4. Just gonna see what we're gonna answer. Done that one. Oh yeah, okay, we'll do that one. 440. List. All right, I'm just gonna add this question in here. So this one here, I've got it on the screen at the moment, and I'm just going to add it in to me. So it says, Marie, can you talk about, what does it say? Hi Marie, can you discuss TCM view on showering after meals and blood volume being moved away to the outer layer in the shower rather than supporting digestion? Is this a myth? Thank you. So makes sense that we wouldn't do this, especially having a massive hot shower right after a big meal. That'd probably be the worst. So yeah, there's a general rule with eating. You don't have to make it too complicated. One of the basic principles is when you're eating, don't do other things whilst eating. Okay. Like, for instance, don't be distracted by a lot of crazy stuff on TV, like riled up emotionally, because all that stuff affects the digestive energy, right? It affects the spleen and stomach. Like the other aspect of it is blood flow, right? Blood flow. And that's what this question's about. When you have a hot shower, is that pulling the blood flow out to the periphery, out to the outside? And if stuff's going out, like if yang's going out, well then it must mean that coldness is on the inside. If warmness is on the inside, then coldness is on the outside, like in a general sense. So if you were to jump into an ice bath, not that I'm saying do that after a meal, it's going to push all that yang inside into your guts, right? So I think this person's saying having a hot shower, not having just showering after meals. So if you need a shower after a meal, because that's the only time you can shower, have a cold shower. I doubt that's going to do much to your digestion, right? Because the cold shower is actually going to push all the yang into your stomach, into your intestines, into your organs. Yeah, your body likes regularity. It likes regular patterns. So what we want to try to do is set up healthy habits, not have habits that are just that unhealthy. So why do you have to shower right after a meal? Like if you have to do it once or twice, every so often, that's probably not a big deal. But if that's going to be your habit, you think, oh, I'll have a big massive meal and then I'll have a big hot shower. Maybe we do it, differently. You have your shower first and then have your food, or if you get so messy after the eating, or the shower's only free because you live in a big house with lots of people and, I've got a shower in my regimented time. Wait an hour or so, at least half an hour after eating is probably better. So that's not a big question. It's not something that I really sort of tell people to do. As really sort of worry about it for people. It's not something I would put in I don't know, like the pertinent things you've got to know. There's a lot of other stuff that's going to be way more detrimental to you if you do it. So it's actually not something that I really even considered until that question was raised. But yeah, it makes sense that you wouldn't do that. Okay, let's have a look. 441. Okay, so we've got a question here a little bit about dampness. Bring that one in. Okay. All right, so this is going to be the question, and then I'll jump myself back in. So this is just me catching up on the questions from the channel time. So Lisa Olivia, she asked a lot of questions, which is great. Good supporter of the channel. So hope you're doing well. And she asks, my legs feel heavy and they ache sometimes, and I feel like they have weakness. Are these all signs of damp? So I've put a few bits on the thread because I haven't had time to be on the channel much lately. And she said, I also forgot to ask, if I have poor memory and difficult getting my words out, could this also be damp cold? And then another person's chimed in, this is super interesting. I also have aches in my legs and back, lower back, and difficulty with speech. And I was wondering if all this could be dampness. So, it's not all damp. Dampness can cause foggy headedness or cloudy headedness, which for some people can be a kind of a muddled thinking or a foggy thinking, and that can be a kind of a poor memory. If it's more like a case of just not feeling clear with your thinking, and that being like, oh, it's just I'm doing that with my head right now because it's almost like it, feels a bit hard to think clearly, and I'm just not, like that. You got in going like that, what I'm doing now, where you just, it's not, you're not being as articulate as you normally would be. You're not being as clear. It's a bit hazy, that kind of thing. That's probably dampness, right? Memory issues where you can't think of a word for something. You've completely forgotten something important, or you've got, memory issues where you can't remember somebody's name, dementia type of issues. I'm not saying that's what you've got or anything, but I'm just trying to give a more thorough answer. These things are not really dampness as such, right? They're probably more, there's probably other stuff going on. It could be blood stagnation, could be that's from a trauma or an accident sort of a thing, or even like a trauma of a stroke, that can be blood stagnation. And people can have speech difficulties and memory difficulties, and they've had a stroke or a transient ischemic attack or something, and they haven't known that they've had it. As in they haven't caught it in time to go to the hospital about it, and they've just gotten on with their life, and they've been having some kind of mini stroke or something. They've had that in the past. That can happen. It also, in TCM, traditional Chinese medicine, it can be associated with the kidneys, Jing deficiency, the brain being the sea of marrow. And that's more like deficiency. So now people get confused, or not confused even, just are they misled a little bit with dampness? If it's coming from qi deficiency, that's more like your spleen qi's weak and there's already deficiency there. So there's likely to be less articulateness of thoughts, because that's the yi, the intellect. So you just don't feel as sharp, you don't feel as clear, and that can be part of that, is that memory, that forming of new memories, that the memorization of things, finding it hard to memorize, you're learning a topic that's really difficult and you're trying to memorize stuff and it just feels like it won't go in. That can be the yi, which is part of the earth, the spleen, and that's potentially associated with why you've got dampness. But dampness from the environment, just dampness, or what you're saying is damp cold, that's more of an acute pathogen. It's not so much necessarily a deficiency there. But the heaviness in the legs, or the leg symptom, let's talk about that, because that is dampness. So I often would explain this to my students when we're talking about lower back pain. Patient comes in and says, oh, my back's hurting. In Chinese medicine, what are the causes of lower back pain or pain? One is stagnation, so chi or blood stagnation, or both of those things. Another symptom, another cause of back pain can be damp, and damp feels like a heavy, like literally like someone's got a rope around your back and pulling on it like an anchor, and you feel weighed down. Your limbs feel heavy. That's part of damp. Like feeling sluggish, like, oh, it's just so hard to get going, and really sluggish and that kind of thing. That's all part of dampness. So, yeah, if you want to learn more about that kind of stuff, the course that I'm running will be helpful to you. Another little shameless plug for the course. So I've just recently, like literally today, updated the web page for the course. I put the link in the description of this video, I think, and I'll put it in the chat. So there's a special for a little while, maybe a month or so. I'll keep the special going. Special price. It's a 3-part course, and it's like an intro. It's the first 3 weeks of my 12-week diet therapy class. But this can be taken just by itself. And what you'll learn is how to think about digestion from a Chinese medicine perspective, how to understand the natures of foods, like what's sour, what's bitter, what's sweet. These natures, these flavors tell us what those foods do. And then if you go on and do the longer part of the course, we go into this week's fruits, next week's vegetables, meats, poultry, fish, that kind of stuff. And we'll go through recipes using those foods for things like, if you've got dryness, if you've got a sore throat, if you've got this, you've got that, like herbs and foods combined, what can we use? 2 foods together, 5 foods together, this kind of thing. You can make recipes out of things, or you can just like use principally that food. So we might talk about, the use of like carrots or pears or something, and what can those things, and if you juice it, if you cook it, what happens, what can you use those things for? Like there's heaps of medicinal recipes about foods. So that's what the course is. And you can click that link to find out more about it. And it's a really, really in-depth understanding that earth element and how to protect your earth element, like how to stop it from getting damp, how to keep your body healthy through different seasons of life, like as in your youth, your middle age, your older age, seasons that you might go through in terms of winter, summer, autumn, spring, that kind of stuff. Also, things like childbirth, post-childbirth, and then into that's all within that first 3 weeks, and then we kind of get into specific illness treatments with foods in the next weeks of the course. Yeah, so to answer this question, some of it can be dampness. Heaviness is a damp symptom for sure, and that could be in the lower back, that ache. So if you feel that ache is partly, like a heavy, it's sometimes hard to define between what's a heaviness, what's a dull ache, and what's a sharp stabbing. I mean, if it's really sharp stabbing, it's not really heavy, but there's no reason why it can't be damp and blood stagnation. There can sometimes be both of those things. Another key symptom with dampness that I forgot to mention here with this back pain and the legs pain is often people will notice, they'll know when it's going to rain, like a internal barometer. They can notice that. They can feel, I feel like it's going to rain soon. And that's often associated with people with different kinds of arthritis. In Chinese medicine, they call that B-Jung syndrome. So B-Jung means syndrome. B syndrome, the damp type of that B syndrome is like arthritis caused by damp, or damp cold, or damp heat, whichever one it takes its form. Awesome. Well, if anyone's jumping into the stream now and they would like to ask a question, you're most welcome to ask a question. I think I have one more piled up here to go. Let's see what we've got. What have we got? What have we got? Must be that one there. Okay, we've done that one. No, it's not that. Okay, I think we've done them all. Okay, that's good. All right, we've done all those questions. All right, if there's anyone else wanting to ask a question, now's the good time to ask the question. I'm going to just quickly check that there aren't any more on the channel that I wanted to answer. I think I've gotten most of them. Yeah, a lot of people, I haven't had time to reply to them all, partly because I was sick last week after I published that video, with just a 2-day kind of flu thing, just not feeling well. But yeah, a lot of lovely comments on the Hun video, so that's lovely, really great and good to meet some new people saying those things, so that's good. So obviously that was a good topic, talking about not the Hun, sorry, the Zhe, the strength to do and finish, like talking about motivation, willpower, and all that sort of stuff. So that was good. Just looking to see if there's any more questions on the channel that oh, another question about hair. Okay, we can do this one. Okay, so we've got a little question here about hair, and this, I still haven't had a chance to answer this one yet, but all right, I'm just going to put that on there. So this is hair. Where are we? What are we doing here? Get rid of that. Uh-oh, I've removed myself from the stream. Oh no. Oh shit. What's happened there? Oh. Am I still on here? Yeah, okay, the audio's still here. Okay, that's good. I've just removed the video from the screen. I'm just going to have to try to find how to add this back again. I'm not sure what I've done here. Video capture, video device. What is this? Camera. Yeah, I'm still here. I'm just trying to put myself back on. Where are we? It must be video. Let's create new. All right, I've got it back again. There we go. I'm back. I don't know why. That just decided it was like, no, I'm not going to play the game. Right, so we're going to put me back in there. And this now, if people have a question, you're welcome to ask a question. I know there's not many on the stream tonight, and that's fine. I'm just going to answer this last one, which is on the channel. I'll put that up the top there. That'll do. And then we'll kind of end it up because it's getting getting to Friday night for me now. So this is a question about hair and iron absorption, as far as I can tell. Let me read this out. Another great video, Marie. Okay, lovely. That's good that you think the video is great, whatever one you're watching before. Oh, this was from one of the recent videos on overthinking brain, foggy brain, and the yi, and the earth element for women kind of thing, the intellect. Okay, so Charlene says, my hair has become very dry and brittle, and my body doesn't seem to be absorbing iron. Can this be fixed with Chinese medicine? So the only way you're going to tell if your iron's absorbing better than it was is to do a test, right, before and after. Like, you'd start with a test before you do whatever you're doing, and then you do a test at the end to know. So I can't claim that it's going to help you, but I would hazard a guess, yes, it will, because if you improve your digestion, then surely your absorption of nutrients is going to improve. And as long as you're intaking the nutrients. So let's say you're taking an iron supplement, or you're eating an adequate diet that's got enough iron in it, and yet your iron is still low, and you don't have any other reason for the iron to not be low. For instance, if you have heavy periods, lots of clots, really heavy bleed, or bleeding that's more than a few days extra than it should be all the time, that's going to be wasting iron, right? Using up a lot of iron. If you've had a big blood loss or something like that, and that sometimes that's why your body's catching up with that, so it's sort of taking time to build back up from having that issue. So if you had a surgery or something like that, but let's say you don't have any of those things going on, so I'm saying if all those other variables are the same, then you can kind of test, is this going to help you? So depending on where you live, the first thing I would do is suggest you see a classical Chinese herbalist. Excuse me, only because we use much warmer herbs that can help increase the functionality of your gut, and you can only get those herbs by a practitioner prescribed. It takes a process to get to be able to use those herbs, but in my experience, that's a lot better than like just standard qi tonics. So I'm talking about hot or warm herbs that are yang tonics that will actually, one of them particularly is very good to act on the small intestine, which means it helps absorption and helps that. Now, how do you know that what you're doing is working in a Chinese medicine way? Well, there's certain things that should be improving along the journey of your life. One is, or the journey of your treatment, one is your bowels should be getting more properly formed and not looser. So if they were loose, they would be getting towards becoming formed. If your bowels were constipated and you're always blocked, the first place of a practitioner is going to be to make sure that's working properly, that system is working, before they can even go in with any warming kind of herbs or tonifying herbs. They kind of have to make sure that that's working properly. So that's what I mean by sometimes there's a bit of a process before you get to what you really need for that other thing. Not every person who is iron deficient is blood deficient, but it's a common association because your blood carries the iron, okay? So there could be blood tonic formulas that might be used alongside of these gut warming like treatments to help your gut absorption. You can't go wrong with warm cooked and moist foods. If you're a vegetarian, you want to start eating some meat. You want to start having eggs at the very least. Not just because of the iron content, but because of that warmth and that ability to digest. Like, that's a big part of it. Now, hair being brittle, who says hair's dry and brittle, might not just be from iron, okay? It could be other things there going on. And treating that yang, if yang is weak and it floats up, it can kind of affect that issue as well. It's not just... there could be other ways that we'll kind of think about it. So your practitioner is going to be the one that's going to be able to diagnose you with what's exactly wrong there. But If you go down the track of acupuncture, you need to do it like once a week for 6 weeks at the minimum. Okay, acupuncture needs to be done regularly to kind of have some kind of like a result there. And you need to think about it as a course of treatment, not sort of like with this kind of thing. Certainly in 2 or 3 treatments, don't even bother doing the treatments. Would be my best advice. Just if you can't afford more than that, go and just do the herbs and then get onto a formula that you can stay on, and that will actually be more cost effective for you, for most people anyway. If you want to go down the acupuncture road, there's so much that acupuncture can do alongside of the treatment for things like mental stuff. You'll feel better mentally much more quicker with acupuncture usually than herbs. And for some people, that stress, that aspect of treating the stress and your sleep, that can have a big effect on your health of your hair. Cool. All right. Well, I hope that's been useful and helpful in some way, shape or form. To people watching this, thank you so much for supporting the channel. Make sure you check out the course, which I've put at the link below if you're watching this after the stream, because some people will be. I'll be messaging people on YouTube later to let them know their questions been answered here. And if you've got a question, I don't know when I'm going to do another live. Probably won't be for a little while. Just if I've got time, I'll do one. And take care. Have a good day, night, wherever you are.